So thank you both so much for the excellent talks. You both managed to give us a broad overview over two important topics, and at the same time you gave us interesting details and food for thought, I think. So we have lots of questions coming in, and I'm afraid it's not possible that we are going to be able to ask them all. Also, Keith and Professor Klugman and Professor Koopmans had a lot of questions to each other, but I think they have to do that over a drink. So let's start with a question from Xavier Says-Lawrence, I think to Professor Koopmans. Is there any good evidence about the potential endemicity of SARS-CoV coronavirus from now on? So Professor Koopmans, maybe you can answer this question.
So I'm not sure if that's a question about endemicity in humans. So yes,
let's talk about humans.
Yeah, I have to say I find it difficult to see the eradication that New Zealand, for instance, seems to succeed in globally. I don't think that's the most realistic scenario. My most realistic scenario is that this will continue to circulate and become one of our winter coronaviruses. There is a concern about enzootic establishment with, for instance, the fur industry. I see questions about mink farms. We see a lot of spillover into mink farms and continued transmission on mink farms. And that's a very big industry also in parts of Asia. That have animal populations that are big enough to have established circulation. And that is something I think we really need to look into.
Thank you so much.
Thanks,
so Didier, do you have a next question?
A question for Professor Klugman. What will be the future of PCV 15 and 20? I'm not sure whether this specifically relates to COVID-19 or in general.
No, I think in general, the big issue we have with pneumococcal conjugate vaccine is the current generation of vaccines. We have three, the 13, and then two 10s, one from GSK and a new entrant from India. But the total number of pneumococcal serotypes just hit 100. And the problem is that the population does shift, and replacement is a big issue. In many ways, this is a bigger problem for developing countries than for rich countries, because the diversity of strains is greater in children in poor countries. And so, yes, we are very interested in next generation vaccines. The 15 is only slight improvement on the 13 with 22F and 33F. The 20, I believe, will have a significantly increased role. However, the 20-valent vaccine has actually been made for adults in the United States. The strains that were chosen were the adult strains, not particularly children's strains. So we at the Foundation are very interested in a next generation 20+ vaccine for children. As with all these vaccines, cost will be the big issue. But we're trying to help manufacturers think about a more than 20-valent pediatric vaccine, because as we know, the best way to reduce the disease burden in adults is actually to vaccinate children. And that's perhaps a lesson for COVID going forward. If we're going to try and eliminate COVID, we have to identify the key transmitters. For pneumococcal vaccine, we know that the key transmitters are the children. And if you immunize your kids, you save adult lives.
Can I counter that? Because that's, of course, a very big discussion. What is the contribution of children in the transmission of SARS-CoV-2? It's clear they get infected. It's clear they can have very high virus titers, but it's also pretty clear that they contribute less. That may be because they are less often symptomatic, and that's a big factor in the whole transmission. So it's quite different from what we see with flu, for instance.
Yeah.
Do you think the people, parents would be willing to vaccinate their children when all we are discussing is let's keep the schools open where possible, because they are less contributor to transmission than if you would then come up with a vaccine and start with the children? To me, that would be difficult.
Well, at the moment, the best evidence we have for what's driving hotspots of COVID is college age, not children at all. So it may well be that we want to immunize those college students to stop transmission.
Yeah, I agree.
So we'll interrupt there because we'll have tonight a whole symposium on the question, should we vaccinate children? So we're looking forward to a very good discussion there. So I would like to go for one question for Professor Koopmans. Can vets give first hints of zoological disorders that is starting to grow? So I think you already touched on it, Professor Koopmans, a little bit.
Yes, I think so. But that's part of the One Health concept, is that you really establish collaborations between the veterinary specialists, human disease specialists, but also environmental specialists, environmental health specialists. Yes, there are occasions where vets can be the first to put up an alert. For instance, if you would have cases of West Nile in horses, that in many regions has been the first sign that something might be happening. But vets and medical experts have the same problem as well, in that many new diseases really are not easily distinguishable from all the regular infectious disease syndromes that you see. So I think it's important to have the clinical awareness that there's something weird or that's an unusual number of cases that are unexplained. But I do think that really needs to be combined with novel ways of testing for the unknown. So metagenomics, virome testing, things like that. And setting that up in a smart way in regions that are most likely to see spillover events. That would be my part of my vision for the future.
Is it not, I want to come back and ask a question too. Is it not absolutely critical to try and stop the spillover from bats to humans? Because, for instance, Marburg is quite ubiquitous in bats, but unless people are killing bats and trying to eat them, it does not spill into humans.
Well, it's eating. That is, of course, a practice that could potentially be stopped. But it's also, I mean, we've had Marburg case just from tourism, visiting a bat cave. So there is wildlife. We have interactions. They are typically rare unless we do strange things. And so that is part of sort of planning, the planning process. There was a question there, what is the threat that you are looking out for? For me, that is Nipah virus. That is another bat-borne virus that when it spills over can cause severe encephalitis. It's seen as a problem, particularly in Bangladesh. And there they have come up with very easy ways of preventing that, because they found out that the bats contaminated.
They urinate, don't they?
Yeah, the palm sap and contaminated fruits, and they have made just simple devices to keep the bats away and solve the problem. So it's just thinking about what is around you, and then planning accordingly.
Yes, thanks. I think we seem to be running out of time. We've reached 4 o'clock, but there's lots of opportunity for discussion, many questions on the chat, and we hope we can follow this on at a later stage. But thank you both for your very insightful talks. I think they were food for thought and made us think about the situation. So we're very grateful for both of you for coming to attend and speak at this conference. So we are now going to be moving on to there's going to be the opening ceremony almost as soon as we finish this. So all of you, please join us at the opening ceremony, and we'll end this opening plenary session. So thank you all for your participation.
Thank you. Bye-bye.
You're welcome.